Question for the governor. You've been pretty busy the last 2 weeks with news conferences and traveling around the state, meeting a lot of people. So how are you holding up, and have you been tested for the virus?
And I have not been tested for the virus. We practice social distancing everywhere we go. I'm doing fine. But believe me, you don't go into one of these battles without a good team like I have over here, and that makes things a lot easier. I'm glad it didn't happen last year in my first year as governor. I'm glad I have the relationships I have with the hospitals, with the cities, with the counties. This morning we had a call with, I know it's hard to believe, all 105 legislators. I don't know how many of them were on the call, but this, where I am and where we are as a state is a result of all the work that we've done to build relationships, the planning that we've done for emergency management for years, and particularly in the last 2 months, and the good work of my coronavirus working group. If I had time, I'd sit in on all their meetings. I'm learning way more about epidemiology than I ever thought I wanted to know as an animal scientist. My mental health and social health is basically because I'm confident that I'm doing the right thing for the people of Idaho. And it's rewarding to always have somebody that's got either the right answer or good options for me to select. And so I'm doing fine, but believe me, there's pressure, and you know, these announcing these 3 fatalities that we just had is very grave. And of course, one of the things when people ask me all the time, you know, everybody that works for the state, everybody that lives in the state, but particularly the people that work for the state, whether they be in public safety or whether they're in the health field, are part of my responsibility. So all we're talking about here, about those 2 graphs, is to make sure we have that capacity there, that I can keep my healthcare workers safe and we can maintain capacity so that we don't have, we have the minimum number of fatalities as a result of this that we can, so.